If you're suffering with repeated back pain, thinking it's your back, it's your spine, it's your posture, or it's your chair at work, what if I told you that your stomach could be causing the problem? There are a variety of reasons why your stomach, abdominal issues can cause back pain. I'm Dr. Yoganand Reddy. I'm a UK trained gastroenterologist. Please subscribe to this educational channel to get more fact-based digestive health videos. Back pain is so common that we see even in our gastroenterology clinics on a regular basis. It can be caused by stomach issues, trapped gas, bloating, acidity can all cause pain that goes through to the back. And most people, and even many doctors, can miss this connection. Let us break into this topic. What is gastric pain? Symptoms that is of bloating, heaviness, fullness, where you feel like the tight feeling in the abdomen, excessive burping, belching, stomach pain, discomfort, which sometimes is felt in the back, in the upper back, in the lower back, between the shoulder blades. This can be as a result of excess of gas in the abdomen. It could be a result of indigestion, acidity. It affects people who especially are following irregular meal pattern. You could be having poor posture, that can also be causing the back issue. Stress. So there are a variety of reasons. How does gastric issues cause back pain? Trapped gas and distended intestines puts pressure on the lower back. Let us say if you're constipated, if your intestine is getting distended with a lot of gas, and people who frequently experience constipation sometimes complain that they're also getting low back pain. So when the constipation gets relieved, the back pain also gets relieved. So there is a fullness, a distended feeling in the intestine that causes that stretching feeling. It puts pressure on the back, causing back issues. Acidity, reflux can also give pain that is more in the upper or mid back. Some people feel that there is gas trapped in the foot pipe, which can be felt right in the back. Somebody just kind of massages their shoulders or back and they burp out the gas and they start to feel better. Bloating and excess of gas also causes muscle tension. So when your muscles are tensed, you can feel the pain in a different part, not necessarily in the same place. So what we call as the referred pain. For example, if you have trapped gas in here in the foot pipe, you can feel the pain in the back. So this is a referred pain. So the pain, just because it's in the back, it doesn't mean that the problem is in the back. So there is a definite connection within our nervous system through this nerve called vagus nerve. So there is a connection between our gut and the spine, the back. Let's say if you have gallbladder stones, sometimes the pain can be felt right through to the back between the shoulder blades, or pancreas, which is behind the stomach. If it is swollen, if it is irritated, you can feel the pain that is digging through to the back, and it can be persistent, and sometimes people end up coming into the hospital because the pain is so intense. So there are a variety of stomach issues that can lead to back pain, or they can simultaneously have back pain. So the pain is in the front as well as in the back. So these issues coexist. How to relieve back pain that is caused by the gas issue, caused by gastric issues? How can you naturally treat without taking medicines? Firstly, you need to fix your eating habits, because a lot of it is dependent on your eating habits. So eat at regular times. So try not to have long gaps, which can, of course, lead to acidity. It can lead to excess buildup of air. So you get that bloated feeling, excess gas. Avoid certain gas forming foods. For example, these vegetables, what we call as cruciferous vegetables, cabbage, cauliflower, broccoli, Brussels sprouts. These are good. They are good in fiber. But in some people, they are producing more intestinal gas. So this gas can get trapped and can give them back pain. Certain amount of lentils and legumes like rajma, chickpeas, kidney beans, they're all good for us. But in people who are sensitive to these, even taking slightly higher amounts or normal amounts, they find it difficult to digest, and this can produce more intestinal gas. So they will have to cut down on the amount of lentils and legumes, especially chickpeas, chole and rajma. Try and chew the food thoroughly and give time. Eat slowly. Do not overeat, because overeating causes stretching of the stomach. It starts to put pressure on your back as well, causing discomfort in the back. The other thing is improving the posture. This is going to be good for your back as well as for the digestion. So sitting upright during meals and also after your meals for some time. So try not to lie down straight after the meal, which is neither good for your spine nor it is good for your digestive system. So where possible, after you have had your meals, especially post dinner, try and have a gentle light walk, whether it is just outside your house, on the terrace, or even within the house. Good 10 minutes of gentle walk can help relieve the trapped gas. Also facilitates the process of digestion better for you. It improves your sleep. When your sleep is better, the digestive system also relaxes better. So this can help your overall gut health. Try and avoid taking sugary foods or too much of refined sugar, because this starts to feed your gut's bad bacteria. So which can then result in this, what we call as this bacterial imbalance and small intestinal bacterial overgrowth, what we call as SIBO. So this can cause a lot of intestinal gas, bloating, and you start to experience along with that back pain as well, because of the trapped gas that frequently can give that kind of a referred pain going into the back. In terms of trying simple remedies, warm water with jeera, or warm water with ajwain, warm water with fennel seeds, or warm water with ginger, all these remedies can help relax the gut, release the gas. So what works for one person might not have the same effect on the other. So you'll have to kind of trial and error to see which of these home remedies will suit you better to clear the gas and also helps you relax the gut. The fantastic natural relief for bloating and gas, especially after dinner, is chewing 1 teaspoonful of saunf, fennel seeds. It's fantastic because it relaxes the gut. It expels any trapped gas inside. It has also got fiber, which can also help, especially if you're suffering from constipation. And the advantage of saunf or fennel is it freshens your mouth. It gives you a nice freshness in the mouth, and this is good for people who have issues, especially those who are having this bad breath problems. It stimulates the secretion of the salivary juice, so which is of course required for our digestion. So the saunf or fennel, having it post dinner, has got fantastic benefits. Your gut and your back are connected, which a lot of people don't even realize. So don't try and think that all the problem is in your spine, in your back. Concentrate on improving your digestion. Concentrate on how to improve your stomach issues. So eating smaller portions, eating especially on time, trying simple remedies, what I mentioned, regular physical activity, and also maintaining a good straight posture can get rid of your back pains that is originating from gastric issues. Please don't forget to subscribe to this channel and also share it with someone who might be suffering from back issues and their problem might be related to actually their gut.